Hello, my beautiful friends, and today I'm going to show you one of my favorite molecules, azelaic acid, and how to apply it in 4 different ways so that you can maximize the results, and also you can tackle different issues. So I'm going to show you, and I'm going to exactly as I go along tell you the benefits of azelaic acid. So you can tackle different issues. So I'm going to show you, and I'm going to exactly as I go along tell you the benefits of azelaic acid. Believe it or not, azelaic acid is found in your own, manufactured by your own skin. It's found in your own skin. So your own skin has its own levels of azelaic acid. Then you're going to ask me that where is this azelaic acid coming from? So if you go and read my post on the skin microbiome, so you have a host of different microbes living on your body, your skin, your scalp. They live there, they keep your skin healthy, they balance the immune system, they keep everything in check. So those microbiota or the microbiome of your skin is essential to your skin health. Acid is azelaic acid. So believe it or not, your skin is secreting its own supply of azelaic acid in small amounts. Now, why would you say that azelaic acid is important, and why is it being secreted by these Melanesia yeast? Well, these yeasts are important. That acid is important because your skin is undergoing natural inflammation. So as you age, as the sun hits your skin, all these things are going to cause inflammation, microinflammation. So the skin counteracts this by producing its own azelaic acid. And I will tell you what azelaic acid will do. Number 1, azelaic acid is going to act as a keratolytic and a comedolytic. So what it's going to do is it's going to unclog the pores, and it also does something very interesting. It's going to stabilize your epithelialization. So what's happening in acne is that all those sebaceous glands are overproliferating, those cells are overproliferating, you're having a lot of sebum, a lot of clogged pores. It's going to unplug that, it's going to take it out, and it's going to normalize that abnormal process of proliferation. So your cells are going to calm down, and when your sebaceous or oil glands, they calm down, there will be less oil. So azelaic acid is number 1, anti-acne, anti-blackheads, anti-whiteheads. It's going to also control active acne, beautiful substance for acne, and it's going to bring down the inflammation. And what's going to happen is, because azelaic acid is going to compete with the P. acnes that causes acne, it's going to naturally bring down your acne bacteria population. So therefore, when the bacterial population is controlled, it's decongesting or bringing up all those plugged, clogged pores. It's stabilizing differentiation. You will have less acne. This is a beautiful anti-acne agent. Number 2, an anti-inflammatory, a natural anti-inflammatory, antioxidant. It's going to bring down inflammation in various ways. So it does various ways. It's going to bring down the markers of inflammation. Hence, it's going to calm your skin. So anti-inflammatory, anti-acne, skin calming. Next, the most important and very essential thing that it does is it's going to go and inhibit tyrosinase enzyme. That enzyme is responsible for churning out lots and lots of pigment from your pigment cells and melanocytes. So it's a rate limiting step. When you use azelaic acid, it's going to go and stop the tyrosinase enzyme to go and stimulate your melanocytes, and hence you will have less, over time, less and less pigment is going to be churned out by those pigment cells. So number 3, it's an anti-pigmentation agent. So it's a brightening, illuminating agent that's going to help with stubborn melasma, with PIH, all those issues with pigmentation. It's going to slowly help that. Then it also has a very interesting antioxidant effect. It's going to retexturize your skin. So reduced pores, smoother skin, even skin, retextured skin, and anti-aging effects. So it's very complex and a very interesting chemical. It acts on different parts of the skin. It acts in different ways, but it's going to tackle the issues at a root level, and very few chemicals do that. The retinoids do that, and this beautiful acid does that. So now let's begin the demo. Now you know everything about azelaic acid. First thing, always, I've washed my hands, so wash your hands really well. If you have the band, you can apply the band. Wash your hands, have clean hands, apply the band, and you're going to begin your cleansing. What am I going to do with cleansing? As always, I have my brush. So this is my Shiseido brush, and I've used this all my life. So you take this brush, and on this brush, I'm going to add a cleanser. Azelaic acid is a very friendly acid. It's a friendly chemical. It likes to work with other active ingredients. So it doesn't like to fight. It's peaceful, just helps you, and it doesn't give you a lot of issues. So azelaic acid is a friendly one, and most of the active ingredients, it really does well with it. The perfect match, as shown by clinical studies, is glycolic acid or an AHA and azelaic acid. So when they did actually a very interesting 12-week multi-centered double-masked parallel study comparing the efficacy and the tolerability of retinoic acid and azelaic acid combo with glycolic, they found that the azelaic acid and the glycolic acid combos did really well. Patients tolerated it really well. The results were great. They were very happy. So my friends, I'm going to take my brush, and to it, I'm going to add my favorite, very low load, 1% glycolic acid by Clinical Botanic. And I'm just going to wash my face with this. Okay guys, so just wash my face with glycolic. If you don't want an exfoliating wash, it's all right. You can also use a squalene cleanser, a salicylic cleanser, whatever you like. So whatever your favorite cleanser is, use that. I like this one because I like my skin to be prepared for my azelaic acid. Okay, so I'm going to just wash. Amazing. See this, guys, it's glowing. Such because this wash contains very low strength glycolic, along with that also very powerful fat soluble ester, vitamin C ester. And what it does, it penetrates and it really rejuvenates your skin. So my skin is already very bright and very clean and deep cleansed. I don't wear makeup, so I don't have to remove my makeup. If you wear makeup, then like I always tell you, please use micellar water, great for sensitive skin. Remove your makeup, then use a cleanse, remove that. So double cleansing at night. I do single cleansing, I don't wear makeup, so this is enough for me. Method number 1 to apply azelaic acid, straight up. So straight up azelaic acid, and I'm going to show you the ones that I use. This one is the one that I'm formulating. It's going to be beautiful. It's going to go into clinical testing. It's going to take many months, but this is a beautiful, beautiful azelaic acid with another 5-6 important molecules that really are going to take care of stubborn melasma, stubborn acne, stubborn rosacea. That's another thing you have to remember. Azelaic acid is going to turn down the inflammation, as is seen with rosacea. It's going to control the microbiome. It's going to take care of those different kind of organisms, and therefore rosacea and flushing and the symptoms of rosacea are going to come down. So this is going to be that. And for demonstration, I'm going to show you this one. So this one is by Paula's Choice. All right, here we go. Paula's Choice 10% azelaic acid booster. I'm going to show you exactly how to apply this. So method number 1, and I'm going to show you how much to take because dosing is so important. You're going to take a pea size. So like a pea-sized amount is going to be like a small ball. The other way you can measure it is like what we do in clinic. That's for steroids, but I like to use it for these strong actives as well. So I'm going to take about half a fingertip unit, and I have explained to you what a fingertip unit is. It's from the crease of your finger to the tip of your finger. That's 1 fingertip unit. You are beginning. If you are a beginner, you're going to use half a fingertip every other day. Half a fingertip every other day. And then you're going to increase it to half a fingertip every day. And then 1 fingertip every day, once a day in the morning and then at night. So guys, I'm going to take this and I'm going to use my dot as always, my mapping technique. All right, and I'm going to take a little bit more here. Why I say this, because that way you're going to give your skin the same dose every day. You don't want to be changing the doses. So remember, skincare is like the good quality skincare. They're like medicinals. So you're not going to just treat it like a cold cream or Nivea. What are you going to do? You're going to gently spread this all over. And azelaic acid, I like to spread it all over. So this is not spot treatment. It's going to go all over your face. Look at this. Okay? It's absorbed. Initially, there will be people who will say that it's going to sting. It is an acid. It's going to sting. So don't go for the prescription strength. You have Phoenicia, you have Skinnerin, 20%, then 15%. If you have severe rosacea, that will help. But then if you're going to go for cosmetic azelaic acid, 10% is good. It's going to keep the irritation down. It's going to sting less. So half a fingertip every other day for a beginner. Method number 1, straight up azelaic acid. If you're going out, wear your sunscreen as usual, apply your makeup and all of that. So that's all right. So daytime, wear this, wear your sunscreen. And if you're using at night, of course, you're just going to use your moisturizer and the azelaic acid. I'll show you how that is done as well. Next, when you're going to increase the dosage, you're going to go up. So for instance, next week or the week after, you feel that this is really doing well and you want to increase the dose, you're going to take half full fingertip unit. So full fingertip unit is like this. Let me show you exactly, because I want you guys to really know how to apply these. So see, actually there we go. Look at this. See that? From the crease of my finger to the tip is 1 fingertip unit. And similarly, you're going to do the same trick. Map it, map it, map it, map it. And you can just put some here, put some here. Okay, and just same. Similarly, you're going to method number 2, you're going to take vitamin C and hyaluronic acid. Vitamin C and azelaic acid, beautiful combination. They're going to really give you fast, glowing, and brightening results. I love this one. This is vectorized L-ascorbic acid, meaning that we haven't done a lot with it. All we've done is taken L-ascorbic, added some salicylium, made it stable, and to this is multimolecular hyaluronic acid. It's absolutely beautiful. Even this on its own is going to brighten your skin. But if you have really, really, really stubborn melasma, then you would want to mix this. So I'm going to show you how to do this. So what you're going to do, you're going to cleanse your face, wash your face with whatever you like. If you have a favorite cleanser, you're going to take 2 pumps of Clinical Botanic Facial Illuminate. This is my favorite. You can use any hyaluronic acid you like, CeraVe, Neutrogena, whatever. This is my favorite. I use this. It suits my skin, so I stick to it. So I take 2 pumps of this. So I'm getting vitamin C. And remember, on a moist face, hyaluronic acid, never on a dry face. So my face is very moist. I'm going to apply hyaluronic acid, 2 pumps of it. Okay, there we go. Done. Then I'm going to apply azelaic acid. So I'm going to take the azelaic acid and I'm going to apply it again. I'm not going to keep on applying the azelaic acid because it's going to be too much of it. Just apply the azelaic acid. Half a fingertip unit in the beginning, 1 fingertip unit in the day after your skin is more used to it. So in a couple of maybe 2 weeks, you can shift, you can move to 1 fingertip unit every single day in the morning. This is method number 2. Hyaluronic acid, vitamin C, azelaic acid, absolutely delicious, beautiful combo. Really brightening, very glowing, taking care of so many different issues. Method number 3. Method number 3, if you have even more severe pigmentation and you're really, really worried, nothing is helping you, and you're one of those people who doesn't like to go for PRP microneedling, they don't want to go for the hydrofacials, for lasers, for IPLs, you're not a very procedural person. You're going to rely then on these holistic topical measures. So method number 3 is going to be, again, wash your face, cleanse your face. 2 pumps of hyaluronic acid and vitamin C is a must if you want fast results, okay? Because remember, azelaic acid is very powerful, but it takes a long time to act. So it's going to start giving you results, I think, in about, I would say, 1 month you'll start to see some effects, some brightening, glowing effects. Then the 2nd and the 3rd month, you will start to notice the acne, the inflammation, everything is coming down. Pigmentation levels are going down. So 3rd month is when you really have to be careful. Then beyond, you can use this long-term, beautiful safety profile. You can keep on using it for months. So 2 pumps of this, Clinical Botanic, hyaluronic acid, vitamin C vector. Then you're going to apply this. Again, half a fingertip unit if you're beginning, 1 full fingertip unit if you are already a user and you want to use it regularly. In the morning, apply azelaic acid. Then you are going to add the best combo. I told you, remember, AHA and BHA. So salicylic and glycolic, and then you have niacinamide. Really goes beautifully with azelaic acid. So then I'm going to take, okay, a couple of drops. 1, 2, 3, let's take 4. And niacinamide sinks in your skin beautifully. So don't worry, it can go on top of your azelaic acid. So now you have a beautiful, light and very non-irritating layer of hyaluronic and C. You have your miraculous azelaic acid. You have gorgeous, mattifying, pigmentation controlling, acne controlling, inflammation controlling niacinamide. And it's also going to stabilize further your azelaic acid and support it. So then you have your niacinamide all over your neck and face. This is method number 3. Now, guys, I promised you method number 4. Method number 4 is maximizing it. So what you're going to do is you're going to stabilize the glycolics, the niacinamides, the azelaic, and you're going to add, beautiful, you're going to add 1, 2, 3 drops of resveratrol. And now, okay, if you have very sensitive skin, step number 4 might be a little irritating, but if you are used to it, then apply it. What it's going to do, so guys, what's going to happen is you're going to top up on your antioxidants. So you're topping it up with this ferulic acid, and resveratrol is going to stabilize all the other layers further. So therefore, and of course, the different antioxidant actions. So you're going to bring down inflammation, control acne, control rosacea. You're going to control hyperpigmentation with these 4 steps. Now, it's up to you which step suits you. You know, what you are sensitive to. If you like method number 1, straight up azelaic acid, fine. Method number 2, Stronger, faster, more powerful. Yes. So hyaluronic acid, vitamin C, azelaic acid. Match made in heaven. Then niacinamide, step number 4, method number 3, sorry, and then method number 4 with resveratrol and ferulic acid. So these are a few ways. So guys, these are a few ways in which you can treat your azelaic acid product. Be careful with the azelaic acid you buy because some of them are very strong and they're not the best quality. So you need to go for a good quality azelaic acid. Otherwise, there's no use. You're going to end up with rash and irritation. You don't want that. Again, every skin is different. If you apply azelaic acid and you notice you have a little bit of a redness and rash, then you can use it every 3rd day. So just like that, look at your skin, see what it's telling you, apply the products accordingly. I can only guide you. I can only tell you the methods and how to apply them. But at the end of the day, you know your skin and you need to apply them the way that your skin can tolerate these different chemicals. All right, so this was the 4-step method. The most beautiful aspect I forgot to mention to you guys is that azelaic acid is beautiful for pregnancy acne. So remember, in the first trimester, a lot of people get a flare-up of acne and then they go off retinoid. So if you cannot tolerate retinoic acid, any kind of retinoic acid, retinols, cosmetic or prescription, you are pregnant or lactating, and for you cannot use retinols, then you're going to rely on this beautiful azelaic acid. So pregnancy safe, it's excellent. You can use azelaic acid while even lactating. So this is, like I said, safe toxicology profile. It's my favorite acid of all is this, but it takes a long time to add, so you're going to be patient. You have to be patient. Please don't be impatient. Just don't apply it for a few weeks and then leave it. You need to give it time for it to start doing its miracles. So please give it time. Try these different methods. If you have irritation, you need to slow down, slowly increase. Tingling and stuff, that's normal, but if it's a really bad rash, then you need to slow down and maybe just use azelaic acid. But I would not forget this because this is important. Hyaluronic acid is going to bring down inflammation. It's an anti-inflammatory. So my beautiful friends, I hope you liked it. If you really want to have faster results, then azelaic acid is going to be applied 2 times a day. So AM and PM. AM if you're going to apply because it's a daytime chemical. AM followed up by sunscreen. At night, you can apply azelaic acid and you can mix it with your favorite moisturizer. Any moisturizer you like, you can mix it. Alright guys, before I go, just a little point. I don't want you to mix azelaic acid with a few chemicals. So try to not mix it, not because they interact. Azelaic acid does well with everything. But benzoyl peroxide, retinoic acid, retinols, even antibiotics, no, there's no need. It's going to increase irritation. This is a natural antibiotic. So studies have shown that this works really well in bringing down the bacteria that causes acne. So you don't need antibiotics long term. They will cause resistance. Just apply this and then the other things that I mentioned. But if you want to use different or retinoic acid, use it at night. Don't use it with this. Use it at night and that's it. So use your retinoic acid, benzoyl peroxide at night. Separate it from the azelaic acid just to avoid irritation. Alright guys, I hope you enjoyed this. I hope that helps you. My aim is that it should help you and it should take care of your skin. It should take care of and tackle various issues like rosacea, hyperpigmentation, melasma. And this demo is going to very clearly tell you how to apply and how to layer these different acids and different chemicals. Love all of you guys and see you next time. Bye-bye everyone.